Now for the next stuff which we are going to discuss is what is known as we'll discuss severe acute malnutrition and sickle cell anemia. So they said that you should list 5, this was an exam question, right? List 5 clinical features of severe acute malnutrition. List 2 complications of severe acute malnutrition. List 5 clinical features of sickle cell anemia. Then list 2 complications of sickle cell anemia. Okay, so let's quickly look at what we got. For the severe acute malnutrition, for the 5 clinical features, there's bilateral pitting edema, okay, usually accompanied with kwashiorkor. There's severe wasting. There's hair changes, so the hair is sparse, it's easy to pluck, the hair is discolored. Skin changes. And then there's lethargy or irritability. There's a moon face, the spleen is large. Okay? No. The liver is large, that's hepatomegaly, right? Then poor appetite, hypothermia and sunken eyes, right? So 2 complications, it could actually lead to hypoglycemia, right? It could lead to hypoglycemia, it could lead to the child having a very weak immune system. So this can prone the child to having infections, you know. So other complications of severe acute malnutrition in children is their temperatures is generally low, electrolyte imbalance, you know, heart failures and dehydrations. So moving to sickle cell anemia now, we'll talk about 5 clinical features of sickle cell anemia and 2 complications. That's according to the exam question, right? So the 5 clinical features of sickle cell anemia is, of course, there's chronic anemia, so it's leading to pallor. So red blood cell count is low. So, you know, for your skin to look so bright like this, is your red blood cells that are giving it that bright color. So if you have low red blood cells, you're having a pale skin. Your skin is becoming whitish, you know, dull in color, you know. If there's any color called dull, all right. They are fatigue, you are weak. There's jaundice, you're having yellow discoloration of the eyes. The skin too can actually start becoming yellowish, you know. Jaundice, painful vaso-occlusive crisis, dactylitis, there's swelling of the hands and the foot, okay. Splenomegaly, there's an enlarged spleen. That's what is known as the acute splenic sequestration crisis, where there's sudden pooling of blood in the spleen, you know. The other features is what? Growth retardation, leg ulcers. Then those children having sickle cell anemia are immunocompromised. Their immune system is just generally weak, so they are prone to having all sorts of infections and all of that. So they said only 5 clinical features. That's for this exam question. So you actually pick anyone you want, you know. 2 complications, you could actually lead to acute chest syndrome, you know, stroke, sequestration crisis, priapism, where the child is having penis. That's for a male child. You are having penile erection, and it's not due to sexual stimulation, right? Then also osteomyelitis. Okay, so that's what we have for severe acute malnutrition and also sickle cell anemia. Okay, talking about the clinical features and also the